Welcome back, my friend. I'm Dr. Kathryn, and I am genuinely happy you're here with me today for day 2 of this special 35-day journey we're taking together. Over the next few weeks, we'll gently explore how to reconnect with your body, rebuild your vitality, and rediscover your confidence, especially when it comes to your intimate health. So take a deep breath. You're exactly where you need to be, following the path carved by educators like Dr. Ruth. This video brings clinical insight into male vitality grounded in science and guided by care. Yesterday, we broke through the silence together. We started a real conversation, honest, personal, about something many men keep to themselves for years. That feeling that things just don't work the way they used to, and how that pain isn't just physical, it's emotional, even spiritual. I reminded you then, and I'll say it again, you are not broken. And you are absolutely not alone. There are steps you can take right now, gentle, effective ones that truly make a difference. One of the simplest is daily massage, which can enhance your circulation, release built-up stress, and help you feel more in tune with your body again. It's not complicated, and it's not strange, it's just you taking care of yourself. But before we move on, I'd love to know something. Where are you watching from today? Drop your city, state, or country down below and let's turn this space into something powerful, a real support network, even if you're sitting alone with your phone or tablet. Remember, you're not alone. This is a growing community, and you're an important part of it. Today, I want to start with a real story, not to surprise you, but to show you that what you're experiencing is more common than you think. A man in his early 70s came into my office not long ago. He's a retired engineer who now spends time gardening and doing yoga. Outwardly, he seemed perfectly healthy and upbeat. But as soon as we sat down, he looked at the floor and said quietly, "Dr. Kathryn, something's off. I've been avoiding intimacy. My partner thinks I've lost interest, but really I just feel nothing. I feel numb and empty inside. I don't know what's happening, and honestly, I feel ashamed." I've heard these exact feelings echoed by so many men I work with. What this man feared most wasn't just physical decline, it was the quiet loss of connection to himself, to his sense of identity as a man. He hadn't failed. His body had simply been changing over time, and no one had ever explained what to expect or how to respond. So let's talk about that, because knowledge changes everything. What most men don't realize is how many small changes quietly build up, especially from midlife onward. First, your blood vessels begin to stiffen, particularly the tiny arteries in the pelvic area. According to a study published in 2022 in the Journal of Sexual Medicine, this stiffening cuts off oxygen-rich blood flow to the penis, and it's one of the first signs of erectile dysfunction. Second, nerve sensitivity starts to decline. Testosterone levels gradually decrease by about 1% each year after age 40. And research reviewed in endocrine reviews has shown that lower testosterone weakens nerve signaling, even when sexual interest is still present. That's why you may feel mentally aroused, but your body doesn't respond the same way. Third, chronic conditions such as diabetes, high blood pressure, or an enlarged prostate can further reduce blood flow and interfere with sexual response. Common medications like statins or beta blockers may also affect arousal and performance. On top of that, everyday struggles like poor sleep, chronic fatigue, or weight gain often reflect deeper hormonal imbalances. These issues layer on top of one another over time. But here's the hopeful part. Once you understand what's happening inside your body, you can make informed choices to address it gently, effectively, and without shame. Nothing here is your fault, but hear us what's empowering. Once you understand why these changes happen, you're in a position to respond. Now, let's circle back to what we introduced yesterday: gentle penis and pelvic massage. It's not ridiculous or uncomfortable, it's a respected, science-backed wellness technique specifically designed to enhance circulation, ease tension in the pelvic floor, and stimulate nerve sensitivity. Clinical studies published in the Journal of Urology and International Journal of Impotence Research have shown that regular, mindful massage in this area can help improve vascular function and reawaken neural response. And Short, this isn't about gimmicks, it's about informed self-care with biological support. Now, let's revisit what we introduced yesterday. Gentle massage focused on the penis, perineum, and pelvic floor. This isn't odd or embarrassing. It's a well-established, science-supported self-care technique, clinical research published in the Journal of Urology and the International Journal of Impotence. Research shows that targeted pelvic massage increases penile blood flow, relaxes tight pelvic muscles, and stimulates nerve circulation in the area. Journal of Urology, International Journal of Impotence Research. In practical terms, that means regular massage may help restore blood supply, release tension held in your pelvic floor, and reawaken nerve sensitivity. 3 critical factors for sexual wellness. Massage directly improves circulation. When you gently massage the base of the penis, the pubic bone region, and the inner thighs, you increase local warmth and blood flow. That helps more oxygen reach nerve and erectile tissues, a key factor in improving erection strength and sensitivity over time. In a randomized controlled study published in the Journal of Sexual Medicine in 2018, older men who practiced targeted self-massage experienced significantly improved vascular response compared to our baseline measurements. The practice also lowered cortisol levels, the body's primary stress hormone, which can constrict blood vessels and suppress testosterone. When combined with slow, deep breathing, massage doubles as a powerful relaxation technique. It calms the nervous system, eases stress, and supports a natural state of arousal. This combination creates an ideal internal environment for sexual function. Beyond the physical benefits, mindful massage helps restore connection with your body. Many men I work with describe that although they initially felt awkward, after just a few sessions, they began to feel more present, less ashamed, more alive, and more in control. Here's what I'd like you to do today. This simple exercise sets the tone for the entire month ahead. Find 5 quiet minutes, no distractions, and sit with your thoughts. Reflect on how your body has changed over recent years. Have you noticed shifts in your energy, your sexual response, or how your body feels? Say it out loud or write it down. Ask yourself, when did things start changing? Do I feel less connected to my body? What one improvement matters most to me? Why does this matter? Research shows that self-reflection and body awareness exercises can significantly improve emotional well-being and sexual confidence in Men. Journal of Men's Health, 2021. By acknowledging these changes, you're not fixing everything at once, you're beginning a healing process grounded in awareness. This video was written and medically guided by Dr. Kathryn 888 based on real experiences with aging male patients, while we use AI-generated visuals to enhance clarity. The insights, storytelling, and wellness routines are based on clinical evidence, personal case reflection, and intentional health education. Every episode is created to serve aging men with dignity and depth, respectfully, science-informed, and with emotional care. Let me close with this: you are not broken, you are evolving. Just like many men who reached this life stage, you still deserve strength, confidence, and connection. Let us make this real. Leave a comment below telling me where you are watching from. If today's insight resonated, type day to complete so I know you're with me. If this spoke to you, please like, subscribe, and tap the bell so you don't miss what's coming next. On day 3, we'll dive into how massage can boost mood, circulation, and overall vitality. Studies from the Journal of Sexual Medicine show that men who maintain a healthy sexual routine report better mood and life satisfaction. You absolutely deserve this journey, and you are not alone. I'll see you on day 3.